This is All India Radio. In the program Spotlight Now, we bring you a discussion on budget expectations for health, education and social sectors. The participants are Shubhmoy Bhattacharjee, economic analyst, and Ruchika Chitravanshi, journalist.
The Union Budget 2022 will be presented by Finance Minister Nirmala Sitharaman on the 1st of February. Lots of expectations from this budget because this is going to be the second back-to-back pandemic budget. So obviously, health sector is in focus. There is also a lot of talk about education sector and social sector schemes. A lot of people are looking up to the government to provide some sort of relief to specifically these sectors. Shubhmoy, can you tell us a little bit about what do you expect the budget to have? We can start broadly by health sector because it continues to be in the spotlight for like 2 years in a row because of the pandemic.
That's right, Ruchika. I mean, what you talked about as the background setting is so accurate that we are 2 years into the pandemic, and obviously what the government does becomes very significant for the health sector's look or watch. The problem there is the health sector has got two types of problems when looked at from the government finance. One is obviously it could do with more money. The second is it could do with an upgradation of its capacity. Now the second part is more difficult. The second part, when I say upgradation of capacity, that means essentially having more nurses, more medical attendants, more doctors. We don't have a problem in terms of supply of equipment, medicines and so on. That's easily handleable. But in terms of the medical infrastructure, reaching to every person, that is a problem. And I'm not even saying that it's a geographical problem, but it's a problem of capacity of the health sector to deliver. So while it has done wonderfully well in terms of injection capacity, it's reaching out to 165 crore people. That's much more than any other country has done. But that is a war-like situation. That is not the normal response of the health sector to daily requirements of the people to keep themselves healthy. Now, when we talk about that capacity issue, the problem that comes along is that the government has very limited ability to deliver there. Why? Because these capacity additions do not change budget to budget. They change over time. So over 5 years, over 10 years, you set up a medical college now, you set up a nursing college now, and it starts delivering over time. That's one of the problems. The other thing is the health sector being extremely disaggregated does not have a very strong capacity to absorb finance. Every year, in every budget, this has been the story for the last 20, 30, 40 years. The health ministry is the one which returns the maximum amount of unspent money to the budget. What does that show? The government spends about roughly, the sentence states, to spend about 2.4, 2.5%. If they were to jump it up to 3.5, it will look extremely good as headline news. But in terms of actual spend, the money will be lying there in different levels in the accounts offices. The health departments of various states, the municipalities, the panchayats are not equipped to absorb a rise so fast. That is a very major problem. So these are the two types of problems that the health sector faces.
We saw a very major increase in allocation to the health and well-being expenditure in the last budget. Now that covered more than what health ministry entails. And in fact, if we look at just health ministry numbers, there was in fact a bit of a drop in allocation. But we had Swachh Bharat and nutrition, a lot of other elements came into the whole thing. So social sector and health sector are also a bit linked, I believe. So in the past budget, we've seen that there is not a major policy or a strategic shift that happens in the budget. And the government will be somewhat constrained by the financial situation as well. In such a scenario, what is the future for the social schemes in this budget? Do you think that social sector is going to get the kind of priority that is expected?
That's a very good point, Ruchika. Essentially, it takes on the same thing that I've been talking about. And this is something that commentators, especially those commenting from abroad, often miss. Health sector or the larger social sector do not have the capacity to spend. Why so? Because health spending or social sector spending essentially means, as I said, two types of spending. One is capacity building. That is the type of people that you need to train to be able to deliver social sector outcomes. And second, you need to be able to make the recipient organizations able to take in that money and spend it well. And social sector, I don't think will be hamstrung by the fiscal capacity of the government as much by the fact that these sectors do not have the capacity to spend. There was a seminal CAG report from 2014-15 which looked at the major social sectors of the government of India and how much they've been spending over the years. And I again come back to that point that their ability to spend has not improved. And this is something which often is not understood and is not being addressed. And this government is also responsible, earlier governments also, at the state level also, that this is something which requires you to understand, like talking the parable of a car, that if a car is a huge fuel guzzler, doesn't necessarily mean that the car will run fast. You need to improve the efficiency of the car. It might be able to develop a far more speed with far less fuel if its efficiency rises. The system's efficiency at the municipal panchayat levels is extremely weak. The doctors and others, one has to really go into it with a microscope and look at it carefully. And that is not the remit of the central government. That's the remit of the state governments. That's the remit of the district level governments to be able to do that sort of work to ensure that they can utilize the fund.
So in that sense, budget is not the right sort of platform to look for solutions, I guess. What do you think?
One can quite understand. I mean, people would also be feeling frustrated that what is happening? But again, coming back to that original building block problem, we have developed, and this is the problem of the Indian governance model, that over the years we have developed lots of our capacity in building infrastructure, which is hard infrastructure. So we are good in building a power plant. We are good in building a road. We are good in building an airport. But we are not good at delivering health services because problem that has happened is not being understood. The ones who need to deliver are hamstrung by lots of problems which is not finance. Yet, when the central government looks at something, it obviously will be looking at it through the prism of finance, because that's what the central government would be doing. That should the central government raise the amount of money to be spent on the healthcare sector. And unfortunately, many of the health experts often miss this challenge. They think that raising the money that is to be spent for the health sector will actually solve the problem. I agree that India spends far less on health than it should be. But today, for instance, supposing a finance minister decides that, okay, let me go hell for leather and raise the money allocation massively. Well, my suspicion is this is not like NREGA. In NREGA, the demand is driven up by the people who are asking for it. And so it doesn't really matter what sort of work you're doing as long as you are sending the money to the pockets of the people. Health sector requires targeted intervention, and that targeted intervention has to come at a far more granular level.
Health is on the concurrent list. So there's also this whole back and forth that happens between center and states on where does the buck really stop. Education is also something that we have seen get suffering a lot as schools are still shut. And the whole access to education during COVID-19 and the whole Digital India e-learning program has been one focus as well. Now, the implementation of national education policy was impacted by the pandemic. And what do you think can the center do in this budget for the education sector?
Education can actually do with a bit of centralized guidance. I would suggest that compared to health, which requires a decentralized approach, education can actually do with a centralized approach. For instance, we have this problem that many of the industry leaders talk about, that we have this huge cohort of engineers or other technical graduates coming out from different places, but with extremely varied level of competencies. Now that just shows that the regulatory system for these systems of training the people from the higher education system is not up to the mark. It should be uniform. Now what will need, it should be the states, but the point is definitely that the cohort of education, the educational outcomes is extremely varied. So you have got extremely good universities and you've got extremely dismal universities. Now that's at the level of higher education. Ditto for the school level. We have a central system of education, which is a CBSE system. But we have also got in every state almost sometimes up to 5, 6 or even 7 boards. So it is absolutely no-brainer that a poor child will possibly be ending up with the worst possible boards. Now, is it possible to actually create a system where the poor child is pushed to the strongest board? Because already the child is suffering from so many handicaps. let's try to reduce that option by ensuring that those children get into the best board and the other children can then, by market principles or others, can select whatever. These are some things which every state can do, and these are very strong policy interventions. And I think a lot of imaginative answers can be created in the budget, certainly in terms of policy frameworks, addressing the challenge and bringing the states and the center together to address these challenges, I think definitely possible.
Overall, what color are you expecting this budget to be, in the sense that we're talking of social sector, health, education? These are very important pillars of any democracy, and there is a lot of talk that happens from the government. But do you think there is enough bandwidth for the budget to really do much for these sectors? And what would you suggest if you were advising the FM? What view would you give on how she should look at these issues?
One of the good things that has happened over the last few years, and that I think is a very, very wonderful thing, is that outcome budget. And the outcome budget has become more granular. I mean, the successive governments have been talking about outcome budgets, but the latest outcome budgets, where actually the government analyzes to what extent and to how well the money that was given was used in different heads, and not just the big heads, but in terms of the micro heads, the minor heads. That is a useful thing. And in the social sector, I think that those are very useful things. I would think that there's a strong role for media to parse through that outcome budget and talk about it a bit more to the people, so that people are involved and get a sense of where the money is being spent. We often have a habit of saying nothing is being done or everything is being done, depending on which side of the political equation one is in. Well, I would say that going through that sort of a document gives a much more feet on the ground sense of where exactly each rupee has been spent and how well it has been spent. So then the finance minister, to answer your question, is forced to ensure that those documents are prepared carefully, answers are given for the type of questions that you're raising, and accountability is sought, because these sectors need accountability by huge margins. That accountability is not coming. I mean, it's easy to see a power plant has not been built or a road has not been built, but the outcome of a bad educational outcome, a school where teachers are not adequately there, they're not taking classes, these sort of things require an outcome framework which needs to be set regularly rather than just sporadic pilot studies here and there. So I would say that that is one very important thing, that the budget has that instrument, the outcome budget, to be able to show to the world that what has been the impact of the government money that has been spent. Also, the education and the health ministries need to be able to take that agenda forward and to show that what has been the type of spending that they're doing. Like as we talked about, that there's a lot of digital teaching that's happening. Well, fine, I suppose digital teaching will be here to stay. We don't know how long this particular pandemic will last, or if there would be others and all that. In that case, what is the thought frame that is being worked out for that digital study? Are the standards of operating procedure, of operating systems being harmonized, bandwidths being talked about, students' access to those are being systematized? So a lot of these things can actually be brought together. You would know in G20 this year, the health minister's outcome has actually been connected with the finance minister's outcome. The G20 has done that. Now, at a global level, we have also signed on to that thing. It is very necessary at a national level, we also accept that a similar sort of a connectivity, health and finance ministries, is ensured. And that is what will give us the advantage of a healthy nation, an educated nation coming up.
That's a very good suggestion. And that is something that maybe the government would also think of linking health and finance ministry outcomes. And hopefully the budget will show some good positive direction for these sectors and their future in a post-pandemic world. Thank you so much, Shubhamoy Bhattacharjee, for joining us today for the show.
You were listening to a discussion on budget expectations for health, education and social sectors. The participants were Shubhamoy Bhattacharjee, economic analyst, and Ruchika Chitravanshi, journalist. The program was produced and presented by the News Services Division of All India Radio. You can listen to it on our mobile app, News on AIR. The program is also available on our YouTube channel, News on AIR Official. You may email your opinion about this program at airnsttalks@gmail.com.